sir. We're going to complete the abdominal assessment. My name is Justin. I'll be completing your assessment today. Have you had any recent abdominal pain or discomfort?
No.
Have you had any unexplained nausea or vomiting?
No.
Okay. First thing we're going to do is we're going to inspect the abdomen. We're looking for abdominal symmetry. We're looking at the contour. We see that the abdomen is flat. We're noting the presence of any scars, which we don't see here. We're noting the position of the umbilicus, and here we're looking for it to be midline, which it is. Next, we'll move on to auscultation. We're going to auscultate the abdomen, beginning with the right lower quadrant. Right upper quadrant. Left upper quadrant. And the left lower quadrant. Alright, we'll continue our assessment. Next we're going to palpate your abdomen. First we're going to do it lightly, then we're going to do it a little bit deeper. Let me know if you have any tenderness upon any of these palpations. We're going to palpate the right lower quadrant. First we're just feeling the skin and the musculature. Right upper quadrant. Left upper quadrant. And then the left lower quadrant. Again, just feeling the skin and the musculature. Next we're going to do deeper. Did you have any tenderness with that palpation?
No.
Okay, we're going to do deep palpation now. Again, now we're feeling for any masses in the right lower quadrant. Any tenderness or pain?
No.
Left upper quadrant. And the left lower quadrant. Alright, after palpation we're going to go back to auscultation. So we're going to listen to your vasculature. First we're going to begin with the aorta. And when we listen to the vasculature, we listen for any bruits that are noted. So far none have been heard. Move down to the right and left renal arteries. Your right and left iliac arteries. And your femoral arteries. Alright, the final piece of the assessment was going to do the palpation of the liver. We're going to use two different techniques. First, we use the bimanual technique. We'll place our left hand underneath the patient, our right hand underneath the right side of the rib cage. Take a deep breath for me. Alright, exhale. And take one more deep breath. We're trying to feel the edge of that liver. Hopefully it's going to be firm and soft and even. Alright. And the second technique will be the hooking technique. We'll place our fingers underneath the rib cage. Take a deep breath. And we can feel the edge of the liver. It's soft and firm and even as well. And that's the completion of the abdominal assessment.